Hi, my name is Dr. Sandra Dorman, and I'm the Director of the Centre for Research in Occupational Safety and Health. Today, on the Northern Ontario Community Immunity Series, we're talking about how does COVID spread from person to person. To watch the entire series, please visit on our website at CROSH.ca. I'm sure by now you are aware that COVID-19 is a highly infectious virus. Understanding how it spreads from person to person can help us take the steps that we need to protect both ourselves and our Northern Ontario community members. Let's start with an individual who has the COVID-19 virus inside of them, actively replicating and creating new virus. This is a respiratory disease, right? And when the new virus is being created, that gets released into the airways. And when we exhale, the virus gets blown out into the environment around us. Now, certainly, a person who has COVID-19, when they're coughing or sneezing or talking, they are producing droplets of moisture that are laden with virus, which can fly through the air. And so if you're in very close contact, for example, with someone, that person, when they're talking, they can spit in your eye, and the virus can go directly through the mucous membranes of your eye, and you can contract the disease that way. In addition, if some of those droplets fly out and let's say they land on the tabletop, and another person touches that droplet and gets it on their hand, and then they touch their eye or their nose or their mouth, they can also pick up the virus that way, okay? And I mean, that's one of the reasons why we would recommend you wash your hands, right? So if you touch something that was contaminated, you wouldn't put it in your face. That is true, but the predominant way that the virus spreads from person to person is actually in the air. This is predominantly an airborne viral disease. And so when I am sick with the virus and I exhale, most of the virus are in small enough droplets that it stays suspended in the air for hours. And so if another person comes along and inhales that air, then the virus gets in touch with new healthy cells, which it then infects, and the disease passes to the next person. I tend to think about or imagine an infected person exhaling viral particles in the same way that someone might exhale smoke. You can imagine how the smoke kind of collects first around the body, but then can kind of drift away or blow away, right? If there's a breeze in the air. Now, if we further consider for a second here, infected individuals, certainly a person with full-blown symptoms of COVID-19 illness with a broad spread infection, they're producing the largest viral load. And so they are at their peak infectiousness to other people. But that doesn't mean that people who don't look sick can't be spreading virus as well. This is for two reasons. One, often before people develop the symptoms of the disease, they have the virus is starting to multiply in their body, they just haven't gotten sick yet, but they can still be infectious in that early stage of the disease. In addition, there are some people who can become infected with the disease and remain asymptomatic, but still spread small amounts of virus that can infect other people. And so you can't judge infectiousness of other people based on whether or not they're showing symptoms of disease. How do you protect yourself? How do you protect your community? Well, the best way right now that you can protect yourself and your community is through vaccination. Vaccination trains your immune system to recognize COVID-19 so that even if you become infected with it, you don't get seriously ill, you don't go to hospital. But in addition to that, if you become infected with it, so if there's a breakthrough infection, your infectious period to other people is smaller than if you had the normal course of disease. In addition, actually being vaccinated reduces your risk of becoming infected at all. And so this is why it's also a key way to protect your community from COVID-19, because if you don't pick up COVID-19, then you can't spread it to someone else. And in that sense, vaccines can literally break the chain of infection from person to person, where if the infected person was going to infect you and you're vaccinated and you don't get it, then you don't infect anybody else within your community. We talked about that actually under the idea of herd immunity in the community immunity series, if you would like to go back and listen to that. In addition to protecting yourself and your community, applying the concepts around this is predominantly an airborne disease, and how can we prevent spread? Well, this is why all of the public health guidelines, best practice makes sense, right? Ideally, socialize with other people in areas where there's high airflow. Outdoors is best. If you're going to be indoors, ideally with a window open or with good ventilation, perhaps with a combination of filtration. Adding personal protective equipment in the way of a mask, for very close contact in the way of face shield, anything that can break that direct transmission of the airborne virus. Certainly, if you're not feeling well, stay at home, isolate yourself from others, and get tested for COVID to make sure that you're not spreading it. And then do continue to wash your hands frequently in case you touch those contaminated surfaces. The faster that we are able to build herd immunity, the sooner that we are going to be able to get out of this pandemic and ideally return to the new normal post-COVID-19. Thanks for listening. Next up on the Community Immunity series is how you can talk about COVID-19 vaccination with your loved ones. As always, we would like to thank the Natural Sciences and Engineering Research Council for funding the Northern Ontario Community Immunity series. And thanks for tuning in.